I'm going to talk very quickly about some different studies I've done in the New York City area. Sort of things that you might seem like common sense, like you could guess what types of foods are being promoted and what sorts of tactics are being used to promote these foods, but it was really interesting to actually quantify these things. And the talk I'm giving today represents 4 different studies that were published on this topic that I was part of. So just a little background. When we look at diabetes and obesity in the different boroughs of New York City, even though geographically they're located quite close to each other, we see that both are higher in the Bronx than they are in Manhattan. And this sort of pictorial just depicts that message right here between diabetes and poverty in New York City, the correlation that we're seeing. So the first study that I was part of looked at online grocery circulars based in the Bronx, and just to look at what kinds of foods and beverages are being promoted. In an ideal world, we would see lots of fruits and vegetables, things that would help people prevent chronic disease or certainly manage conditions. So what we did, we assessed these different circulars. We looked specifically at sugar-sweetened beverages, refined carbohydrates, high fiber, and also fruit and vegetables. We looked at the front page of these circulars, since typically that's really what catches attention. Not all people are able to scroll through the entire thing. And we looked through 12 of the different 26 zip codes in the Bronx. For each product, we looked at the price, whether it was processed, the amount of fiber, carbohydrates, and sugar, and also the different promotional strategies that they've used. And I'm sure we've all been victim to this at some point in time. 3 for $5, why not just go for it and load up the cart with different things? But what products are they applying this to? So we looked at a total of 2,311 products, and we found that the overwhelming majority were processed. They were over a third were refined in carbohydrates. We had about only 26% were fruit and vegetables, and very low fiber foods. These were the ones being promoted on the front page of the circular. Additionally, which certainly caught our eye, was that almost 60% of the beverages that were advertised or promoted were for sugar-sweetened beverages, and this was something that really stuck in our mind. These are typically products that they apply that promotion to, and they really encourage the consumers who shop at these stores to purchase these products in bulk. So the implications from this study were, just not just looking at the price of things, but really, what are you promoting? What are you really pushing in these online circulars? And really making us think about the grocery store as a place where that could play a really integral part in the health of people. In a perfect world, we could get grocery stores on board with not being as concerned with profit, but really the product and making these things highly available to their customers. What we did is we then piggybacked on this idea, and we looked at specifically at advertising sugary beverages and this time we used census data to look at the highest income zip codes in New York City and the lowest income zip codes in New York City. So that is including all the boroughs. And we looked at the online circulars in those places to see, are there any differences in not only in added sugar, but the total calorie content as well for these beverages in the zip codes? Because we know beverages actually make up a lot of the calorie content for people's meals. So using the census data, we were able to determine the highest and lowest zip codes, and then we looked at the online grocery circulars here. We looked at the total number of sugar-sweetened beverages, the total calorie content, total calories from sugar per serving, and if it was marketed as a high or low calorie beverage. So naturally, what we thought came true. Beverages in the lower income areas were higher in calories, and they were higher in sugar as well. So there's an interesting trend that we're noticing sort of in this advertising. So we're looking at circulars, and sometimes they're within the exact same chain of grocery stores, yet all circulars are not created equal, which we're finding. So you can have circulars and that's just your weekly flyer of promotions for the exact same chain store. Yet in the Bronx, they're promoting foods that aren't nearly as healthy or that are higher in sugar than they are in Manhattan. And so that is something that, all my students could attest to the fact that it makes me frustrated, and there's an underlying theme here. So just looking at this a little bit further, the lower income zip codes tended to have these higher, more sugary drinks being marketed. Opportunities certainly exist here as well. It's not just about educating the public about these sugar-sweetened beverages, but it's what do they see? What do we make available? And it's sort of what Dr. Teddy was talking about here. We're sending one message, but then you're seeing all these images all the time of things being promoted and what's affordable and what is really accessible. Health literacy, health numeracy, understanding numbers, understanding the implications of consuming certain products is one part of the picture. But the more you could get the community members, different organizations on board involving grocery stores and maybe helping to understand what the issue is and what types of food would be beneficial to promote would be incredibly helpful. But again, that would be a perfect world and a perfect scenario. Along this exact same trend, I sort of hit the streets of New York City and the different boroughs of New York City, looking at not just what's promoted, but also the price and the availability of nutrition information in a very popular fast food chain throughout the city. And I did this myself, traveling throughout the city, through all the boroughs of the city, through the lowest income zip codes and the highest income zip codes, looking specifically at the cost differential between the healthiest meal item on the menu, which was a salad with grilled chicken, and comparing it to the least nutritious meal on the menu, which was a stacked cheeseburger. So we looked at the cost differential and, yes, actually purchased these items begrudgingly so we could verify it with a receipt, and donated them to various people around. And then we also looked at how available is the nutrition information in the store. You would not think it's as hidden as it actually is. And sometimes it's a large poster behind a counter. And so as a consumer, you would never be able to use that information in your decision-making process unless you were allowed to walk behind the workers, behind the equipment, and look at the nutrition information on the back wall. And then we also recorded and quantified all the promotions on the walls and windows of the different facilities. So our sample was 70 fast food chain restaurants, 35 were in the highest income, and again, 35 were in the lowest income zip codes, and we actually went to each one of these stores. So this was a labor-intensive project. So we looked at all the promotions, we took note of their language, we took pictures of the promotion so we could analyze them in greater detail. And what we found was that, once again, in the lower income facilities had many more promotions than in the higher income facilities. Almost every facility had at least one promotion. We found the healthiest meal item, which was the salad with grilled chicken, to be much higher in price. The mean cost of that item was $5.33, which compared to the least nutritious item, which was $1 on the value menu. And that's a very significant finding. So this again goes back to the fact that you're making something. Is it really available? It is on your menu, but when someone goes in there and you sort of promote that as, look, now we have healthier options on our menu, but is it really an option when the cost differential is that high? $4.33 is the cost differential there. So the implications here, in lower income communities, access to fast food restaurants and consumption could really have an impact on someone's health. And so using the language that these options are now available is really tricky, because when you price it out, and this all stemmed from just my own observations of entering a place like this and saying, if I wanted to make that healthier choice, I'm going to pay a lot more money than I will to make a different choice. And so that's a practice that, again, in a perfect world, it would be fantastic if we could see some of those healthier items become more available. And then what we did, we used that data to then look at the nutritional content of the items that were promoted. So in a separate paper, the fourth and final paper, every item that was promoted, we got all the nutritional content for those items. And when we compared to the higher income neighborhoods, the lower income neighborhoods had significantly higher representative promotions for sugar sweetened beverages once again. So there is definitely a trend here that you'll notice, whether it's online circulars or in different restaurants, and I'm sure these findings would probably be replicated in other settings as well throughout the city. So basically, having those promotional materials, which are almost always on the doors of the store, so you're walking in, you're seeing it. Sometimes they're items that are 2 for 1, so you're getting double the amount, or they're just selling them at a reduced price. Those are sending cues to you to make that purchasing decision. So it's interesting how we see more of this in the lower income areas than we do in the higher income areas. And the other thing is that the comprehensive nutrition information is not available. We either saw it in the way back of the stores, like I said, and sometimes it is on the flip side of the tray sheet, which no one would ever, which you get the tray, obviously, once you get the food that's on it. And so you would never have known, aside of the calories posted, to see the comprehensive information. That does nothing to put it on the bottom of a tray sheet once you get that meal. So the bottom line here is that there are a lot of environmental factors going on, and there are a lot of health issues in the New York City area. These different facilities could play a part in their own part in sort of helping out the citizens of New York City, thinking about not only the physical environment, but the digital environment and the different marketing tactics that are used in these environments.